Okay, this is part 2 of the CPR. This time I'm going to be talking about using the anesthetic machine. Our anesthetic machine here is attached up to the wall. We have a scavenger as well as the oxygen hookup. Since I'm using a doll, I'm not going to actually hook the oxygen up at this time, so not to waste it. But what you want to do is to make sure that you assess your patient again as before. Use your laryngoscope to properly intubate your patient, and then you're going to attach the tube to the anesthetic machine to the tube that's on your patient. As you do that, you come over to your there we go. Stay there. Sorry about that. Thank you. So as your patient is laying there, you can use the bag to be able to breathe for your patient. What's important is we have 2 valves on our anesthetic machine. We have the emergency and then the actual shut-off valve. For safety purposes at our clinic, we decide to keep this taped up to make sure that it stays in the placement that it's supposed to be so the air is properly flowing and our patients stay alive. So we decided to just use the emergency shut-off valve in order to breathe for our patients. So when you're using one of these systems, what you want to do is press down on that shut-off valve, take the bag, and you're going to give a nice squeeze. When you squeeze it, you're going to want the pressure to be anywhere from 10 to 20 amps per pressure so that you're getting a nice rise of that chest. So again, press down on the emergency shut-off valve, press up on to that bag that's full of oxygen, and that will make it so that your patient's chest will rise and they're getting the air that they need to have while they're being intubated for CPR.